A 68-year-old male former smoker, 50-pack years, presents with worsening dyspnea, productive cough with purulent sputum, and fatigue over 3 days, possibly from a respiratory infection. His elderly age and male sex align with smoking-related lung disease. He uses home oxygen. Physical exam shows barrel chest, distant breath sounds, and accessory muscle use. Laboratory values include arterial blood gas with pH 7.28, PaCO 265 mm of mercury, normal 35 to 45 mm of mercury, and chest X-ray with hyperinflation.
What's your diagnosis?